Oncology.TV here at ASH 2013 in New Orleans. And joining us now is Dr. Alok Khorana. He's from the Cleveland Clinic. Thanks for being with us, sir.
Great, thank you.
What is the significance of thrombosis in cancer?
So thrombosis is a very common complication in patients with malignancy. About 1 out of 5 patients with cancer develops thrombosis, and that has consequences for patients with cancer. Some of the consequences are once you get that first clot, you have to be on anticoagulation for several months after. Anticoagulation can lead to bleeding, and more importantly, even more importantly, getting a clot in cancer has been linked with increased risk of dying while getting treatment for cancer. So there's a lot of different consequences for patients with malignancy getting clots.
With thrombosis being so prevalent in cancer, how are you treating it?
So there's been a lot of data evaluating the need for prophylaxis in patients with malignancy specifically related to thrombosis. And in certain settings, sort of the data are very clear. So if you're a cancer patient and you're in the hospital for a medical problem such as pneumonia or febrile neutropenia, then getting a daily self-injection of low molecular weight heparin or a 3 times a day injection of unfractionated heparin is a great way to prevent clots in the hospitalized setting. Patients with cancer that undergo major surgery, such as abdominal surgery for colorectal cancer, for instance, should be on at least 1 week of prophylaxis, and in some cases up to 4 weeks of prophylaxis to prevent clots from happening. But the majority of clots currently in the United States are occurring in the outpatient setting. So about 80% of clots occur in the outpatient setting. And there we don't have such a great way of preventing clots, primarily because patients are at risk for long periods of time, several months while they're getting chemotherapy. One of the ways we've uncovered which patients are at risk is the development of risk score that my colleagues and I developed in 2008, and that has now been validated by a number of other institutions. And the risk score is very simple. It takes into account 5 variables: the type of cancer, BMI, and then components of the complete blood count: the hemoglobin, the white cell count, and the platelet count. And combining these variables, you can find patients who are at high risk, and high-risk patients really should be educated about the warning signs and symptoms of clots: leg swelling, chest pain, shortness of breath, new cough, hemoptysis, and so on. And some of those patients may benefit from outpatient prophylaxis, and that should be considered in these patients as well.
What are the highlights of the research you're presenting here at ASH, and what is its significance to the community hematologist?
So over the years, we've developed various ways to identify risk of cancer patients getting blood clots, but we haven't developed a good understanding of the mechanisms of why cancer patients get blood clots. And the research we conducted that we're presenting at this ASH meeting is related to a novel technology called proteomics. So over the past 20 or 30 years, we've moved from sort of doing single molecule testing to multiple molecule testing. We do that very commonly in genetics, where we do gene expression profiling, for instance, or genomics. And we've just developed proteomics, which is sort of the extension of genomics into proteins. And so we can analyze small amounts of blood from patients with cancer for hundreds of proteins. And the abstract we're presenting today discusses a proteomics-based approach to understanding mechanisms. We looked at both patients with pancreas cancer and lung cancer, and we were able to identify several proteins that were upregulated or downregulated in patients who got clots versus patients who didn't. And we believe that this work can lead to screening tests for identifying which patients are, at greater risk for getting blood clots, and therefore those patients could be targeted for prophylaxis in the future.
What is the future of your research?
We're working on incorporating newer agents into prevention of clots. We are working on better ways to educate patients about clots, and we're working on better ways to do sort of personalized medicine or precision medicine in identifying both the risk of getting clots and also the risk of bleeding, because that's one of the complications of being treated for clots. And hopefully we'll be able to deliver very soon on sort of risk assessment tools that can really individualize prophylaxis patterns for cancer patients.
Doctor, thank you. Dr. Alok Khorana from the Cleveland Clinic, joining us here in New Orleans at ASH 2013 on Oncology.TV.